Yeah, hi, I'm Matt Clacy. I'm the founder and chief commercial officer of Paratus Clinical. I've been working in clinical research now for well over 25 years.
Hi there, my name's Dr. Amber Leah. I'm the Principal Investigator at Canberra and one of the medical directors for Paratus Clinical.
Today we welcomed the Taiwanese delegation, which included a mix of government officials from the Taiwanese FDA, other government groups, and a number of physicians from various locations around Taiwan. Really to explore the difference and the similarities in the two ecosystems. So how we get research up and running, what procedures we have in place to protect everybody, and regulatory hurdles that we need to jump through to the practicalities of running research in both public and private sectors across our two countries.
Paratus Clinical runs a range of clinical trials ranging from phase 1 to phase 3. We are involved in vaccine studies as well as treatment studies across the primary care spectrum, including studies of asthma, diabetes, weight loss medications, cardiometabolic studies. Today we discussed clinical trials across a range of primary care specialties, as well as outpatient specialist clinical trials related to dermatology, respiratory, and outpatient care of other specialty studies, including oncology. Today we had a discussion about the differences between inpatient and outpatient care, as well as the primary and private industries.
Hello everyone, I'm Huang. I'm the Dean of Office of Human Research from Taipei Medical University. My office oversees the clinical trial in our 3 affiliate hospitals. So it's a really honor and pleasure to be here. Thank you.
Hello everyone, I'm Pin-Kuei Fu. I'm a professor in Taichung Veteran General Hospital and also in charge of Clinical Trial Center. Our hospital located in the central Taiwan and is the national scale hospital and referral center in central Taiwan.
Australia has established itself as a very strong hub in clinical trial in Asia Pacific region. I would say 4 very important elements actually shape the current condition of Australia. The first one is a very efficient regulatory framework, such as the CTA and the CTN. These two systems, these two processes can improve and also foster the rapid clinical trial startup. Second one is the scheme called National Mutual Acceptance Scheme, with only one approval from IRB that will allow the other institute to establish. And the third one is the R&D tax incentive. The last one, but then the least, is the very high quality healthcare system. I believe all these 4 elements can shape the current situation of Australia, and actually that's the part we learn most from this tour. Over to you.
Yeah, I think the most important thing for clinical trial is the speed. From Australia experience, we learned that the conduction speed in clinical trial is very fast in Australia, and because the national scale providing one-stop service for pharmaceutical company, for industrial, and for IIT trial. I think that is the most important thing to succeed and to progress the clinical trial the speed. And in addition, I think the transparency is also very important. So on every the regulation system of Australia is also we can learn from Australia administration from clinical trial. And in addition, I think medical care level in Australia is very, very high. So it can provide in patient needs. And we also want to share that clinical trial is an opportunity to patients to receive the future medicine. So I think what we learn from Australia, this experience can bring to Taiwan, and we can join the clinical trial in an international clinical trial together.
Yeah. On top of that is that today we are honored to be here. It's Paratus Clinical Trial Center. This is a very new modality to us because most of our clinical trials were done not in the clinical label. They were sort of like in the centers. So today we learned a lot from this private sector. They actually did a very good clinical trial. So I actually learned a lot from that. So maybe when we go back to Taiwan, we will discuss with the government to so that also bring all the stakeholders together to discuss. Maybe we can accommodate this modality and employ them in Taiwan so that more patients can be benefit from this practice in Taiwan.
Yeah, I think we learned from how to cooperation with the GP level because from previous experience, most of the clinical trial conducted in medical center, in the hospital base. But in this morning, we learned a new modality, new model to cooperation with GP doctor to doing clinical trials such as diabetes, heart failure, or pulmonology disease. So I think this is a new way to facilitate clinical trial in GP level, and it can help so many patients to join a clinical trial in the future.
Today we've discussed the differences and the similarities between running clinical trials in both public and private settings, including the storage of data across different study designs, startup timelines, regulatory requirements, as well as the type of patients that we can recruit to different types of studies in both private and public settings.
I think that the most interesting thing is the amount of similarities that we have as two countries. People always like to focus on differences, and I think it's reassuring that a lot of the things that we do in Australia are very similar to the good practices that are happening in Taiwan. One of the things I think we can learn in Australia is more collaboration between our public and our private sectors. It seems to be much more embraced in Taiwan that the two groups will work together, and it can only be for the benefit of the patients and healthcare in general.